Hi guys, I wanted to come on and share a few tips on breast engorgement. I think that the word it can be a very scary word, and it's often a word that no one thinks about or knows about until you get pregnant and have a baby. It's hard to know, are your breasts engorged? Is it a problem? What to do about it? So I wanted to come on and just share a few tips about it. So the first thing is, are your breasts engorged? Typically, breast engorgement is occurring because your body's producing more milk than your baby needs. And so they're gonna feel hard to the touch. It might be hard for your baby to latch onto the nipple. And so a quick kind of assessment that you can do is take one or two fingers and touch your breast and ask yourself, does it feel like my lips? Is it kind of squishy like that? Does it feel like my nose where it's a little squishy but also kind of hard, or does it feel like my forehead? And if you do this test and it feels as hard as your forehead does, they're probably engorged. And so there's a few things you can do. The first thing I recommend is getting into the shower, using warm water, and just standing there with the water coming down on you, and just allow it to hit your body, to hit your breasts for a few minutes, and then do some hand expression. You can do that using a C shape around your breast or a U shape, whatever you feel comfortable with, and just express a little bit. You're not expressing so that your breasts feel completely deflated. You're expressing enough so that you feel comfortable and you no longer feel discomfort. And then you can get out and nurse your baby, and the baby will be able to latch on better, and it'll also lessen the flow. Another tip that I have found really helpful is if you are trying to nurse your baby and you're already sitting there and baby can't latch on, or maybe the flow of breast milk is super intense and it's hitting your baby in the face. That happens all the time. Your baby will recover. But what I recommend doing is doing, again, some hand expression using a C shape or a U shape, and expressing a little bit into a towel, into a bowl, even into your sink, just enough to get the intensity of the flow out so that it's flowing a little calmer, lessen the hardness of your breast so it's easier for baby to latch on, and that'll also take away some discomfort. And then go ahead and continue breastfeeding your baby. And I think that with those two tips, you can really lessen the effect of engorgement. And another thing you can always try is cabbage leaves, which sounds like an old wife's tale, but it really does work. I would say for about 20 minutes, 3 times a day, after you've breastfed your baby, go ahead and put cabbage leaves into your bra and just walk around with them in there. No one needs to know. And then after about 20 minutes, just take them out. And again, do that about 3 times a day, and that should help with engorgement as well. Whenever talking about engorgement, it's really important to remember if your breasts are red, if they're shiny, if they are super, super hot to touch, that could be a sign of infection. And so you always want to reach out to your care provider in that case. But if you have any questions on engorgement, any questions on feeding your babe, I'm here to chat with you. I would love to talk more about it. We have other CLCs on staff too. So just shoot us a message and we can get to chatting.